Well, what I can do is give you a typical day in A. The first day I arrived, I was taken over in a van. And first of all, it was stormy, it was cold, and they put me on the van with no blanket or coat or anything. And I thought that was a little bit strange from the hospital, but it was my first time, and so I just kind of went with the flow. But when I got to the facility, they had had poor communication with my husband, and he had gone home to have dinner. And they took me off the van and set me in a room and said they couldn't do anything to me or for me until my husband arrived, that he needed to check me in. So I sat in a room in my wheelchair for 2 hours. And finally, my husband arrived, and then they were able to take me out of the wheelchair and put me into the bed. And so my feelings in the very beginning was very frightening. I didn't know what was going to happen next. They didn't explain anything to me, just that was my room and that I would be responsible to eat in the room, but they didn't want us eating out in a dining room area because of Alzheimer's patients. And so the first night I was there, I had a few problems with nausea from the surgery, and I kept trying to communicate with my CNA that I was feeling very nauseated. And she kept telling me, oh, you just need blanket. And I said, no, I don't need a blanket. And I kept holding my stomach. But I could never get through to her, and finally I became sick to the stomach, and the only thing I could do was grab a garbage can, but it had no lining in it. It was just a plain garbage can. And so that was my first night there. The next day I did meet the staff. They were nice, but I didn't feel safe with them. They'd come in and they were questioning things to do for me. And I didn't know what I was to have done. It was so new to me. And I knew I was diabetic, and I knew I needed my insulin. And I kept telling them I needed my insulin, and they kept telling me they couldn't get my insulin. And so I went 48 hours without insulin. And finally, my blood sugar went up to 500, which set off alarms. And they finally got my insulin to me. And so that was the second thing that really worried me, my medication, because it wasn't given to me on time. It wasn't given to me the right amount or the right medication. They didn't follow what I was already taking, and the insulin was the most crucial. That was really scary. During the night when they would come in, several times they'd say, well, you need to have tetanus shot, and it's 3 in the morning, and they wanted to give me the tetanus shot, and I kept saying, I don't need a tetanus shot. I've already had a tetanus shot, and I hadn't had any problems, so I didn't know, and it come to find out it was TB shot, and he kept calling it a tetanus shot. And this was at 3 in the morning. And then the second night, during the night, the same nurse came in and said, we need to do an overall check for any growths, any moles, at 3 in the morning again. And that was strange to me. The other thing that was really hard is we did not have a shower in the room, and they didn't keep the bathrooms clean. We'd go days and they wouldn't empty the garbage cans, and we'd have to ask for toilet paper and stuff like that, and go days and days before they'd come in and sweep and clean the bathroom. And after a month there, it was kind of very unsanitary. There was a shower in the hallway, but I was only asked if I wanted one. I had 2 in 27 days for showers, which I'm used to all the time. And so, but here again, I didn't know any better. I thought this was normal, and even though I was very uncomfortable with it, I thought it was what everybody did. And when it came to the physical therapy, my therapists were very nice, but their attitude was, we do it and we do it until you break. We hit as hard as we can. And after the 4th day, I was petrified to go to therapy because it hurt so bad. And I knew if I would explain it to them, they wouldn't stop. They just kept doing it. They would say, you're not going to be able to get out of here in 27 days unless we do this. And therefore, I was panicky because it really hurt, and I was frightened because I never had control of how much was going to be done. One of the biggest things that happened, I felt like I was getting pneumonia. My chest hurt, and I kept telling them, I said, I think I've got pneumonia. And oh no, just after surgery, that's really common. And I kept saying, no, I really think that there's something wrong. And I would cough and cough and cough. And finally, a doctor was in the hallway one night in the middle of the night and heard me. And he ordered an x-ray in the middle of the night, and I did have pneumonia. And by then they'd lost 4 days of treatment on me for that. So I don't know if that answers your questions, or...
Kind of the experience.
3 months, had
later.
gone by, and I was greeted at the hospital by the driver of the care center, the rehab center, just as friendly as could be. Made me feel like we were best friends already. He took me down, put me in the van, and made sure that I was comfortable, and he told me where we were going, and I was teasing him and tried to get him to stop at McDonald's and have a hamburger on the way, but he said he couldn't break the rules. But he was very sweet and very gentle. And when I got there, the staff was waiting for me. They had my room all fixed nice, and they made me feel like I was a celebrity coming into a building to stay. They had 3 people walk us to the room and show us the room and explain about dinner and lunch and breakfast and who we'd be having help us, and if there was anything we needed, how to get to them. And they kept saying, now, do you have any questions? We want you to feel at home here. And then when they left, one of the CNAs came over and gave me a big hug, and she said, we're going to be okay. She says, when you leave here, you're going to feel so much better. And from then on, I felt so comfortable. And they would come in to give my medication, and they'd tell me what they were giving me. And did I have any questions? Did I feel good about having it then? And in the middle of the night when they'd come take blood, they'd always say, tell me why they were doing it for my blood sugar. And then they'd say, now you're a little high, so we're going to give you a shot tonight so that we don't let it get out of control. And then in the therapy department, you felt like you were at a spa. I did the same exercises, but I was in control, and I wasn't frightened. And because of that, I was able to do so much faster than the first surgery, because I knew what was happening, and I knew I didn't have to worry. And then there we also had occupational therapy. And every day for an hour and a half we'd go to occupational therapy, and we could hardly get down there fast enough. They made it so fun for us.
And how they do that?
And one of the things they did is they told us they wanted to make sure we knew how to take care of ourselves in a kitchen. And so my occupational therapist said, I'm going to take you on a date. And we're going to go buy groceries at the store, and then we're going to come back, and the next day you're going to cook. And he says, what would you like to cook? And so I told him, and he says, well, we want to make sure that you're ready to get in and out of a car. So he says, today I'm going to pick you up, and I'm going to drive my red sports car in front of the building and pick you up, and we're going to see if you can get in and out of the car. And we did it 4 times, in and out, and in and out. And then he said, do you feel comfortable about it? Do you feel that you would like still to go to the store? And I said, I'd love to. I was so excited. And so we did that. We went to the store. The first time we took the wheelchair and the walker and everything. And it was just a wonderful experience. We made it, and then we walked to every room and delivered what I had made to the other patients. And it was fun. I got to meet a lot of the others that I hadn't met before. And so therapy was not a frightening thing. It was an exciting, fun thing to do. And if we ever did anything that they knew was hurting me, they'd tell me why it hurt, and that I had to have some discomfort to progress, so that my knees would progress properly. As soon as they told me that, I wasn't frightened at all. Then the other thing that they really made it nice is they had a beautiful dining room with tablecloths, a beautiful menu every day. And we were able to ask our friends and family to come eat with us. And they served us like we were in a really nice restaurant. They showed us respect when they'd bring us stuff, and they'd ask how our day was, and was everything okay on the menu? Did we enjoy it? And then afterward, a couple days a week, they would have a guest come, or one of the staff who sang would sing to us out in the foyer for a half hour. And we'd all gather around and listen to them sing or play the piano or whatever. And then we'd go back to our rooms, and we felt like we'd been out for the afternoon downtown with a fun hotel or something. And then on Fridays, they'd always have an ice cream social for anyone that wanted to come, past patients, or family members. Everybody was welcome. So that was fun. And one of the cutest things they did in occupational therapy was I had a different therapist this one day, and she said, do you like to garden? I said, no, I don't like to garden. My husband's the gardener. And she says, well, your assignment today is do gardening. And I said, okay, let's try it. So we go out in the courtyard where they have a little garden with vegetables and stuff and flowers. And I took my walker out, and she said, now what I need you to do today is pull all of the weeds out. And they had it high, so I wasn't afraid of falling. And she said, I'll bring the hose over for you, and I'll be here with you, but you're the one that has to do all of that today. And so I sat outside, and we watered the stuff. I watered the stuff and pulled the weeds, and I went back in feeling so good about knowing that I could do it. That when I got home, I could be up and do something like that. So that was a fun experience. And then one of the cute things, when I left, you get very close, or I got very close to this staff. And when I left, they all came in the morning to tell me goodbye and give me a hug and wish me good luck. And they just made me feel like they were really going to miss me. And I knew I was going to miss them. So that's my story. Gives you both. Yeah. Both incidences.
Facility.
Oh, I would recommend them in a minute. in a minute. And I have told many, many people about it since then. And several have gone there and felt the same way when they left. It just couldn't have been a more... In fact, my husband was afraid I didn't want to come home. Because I met so many wonderful people there, and the other patients, we were together a lot because therapy and going to the music and eating, that we really bonded. And we'd cheer each other on when we didn't have to use the wheelchair. We could use the walker, or if we did something new, we all clapped. And so it was just a good experience, and you felt good about it.
That's so wonderful to hear.
I didn't meet one patient in the first place, personally. I would see a couple in therapy, but we never talked, or there was no... And I ate every meal alone in the room, so I didn't have any way of meeting people that way. So just... I think it makes a big difference emotionally how well you go through it.
Yeah.
My second surgery wasn't near as hard, and I don't know if it was because the setting was so wonderful for rehab, or if it was easier because it was my second one. But by far, it was so much better, so much better. And one night, I woke up about 3 in the morning. They'd come in to give me some medication, and I said to the nurse just kiddingly, "I'm just starving." And I got up, went into the restroom, and when I came back, she had colored a cute little a little mat, and she had 2 graham crackers on it, a thing of yogurt, and some stringy cheese, and then put a big heart and a smiley face. And I thought, now that's really going the extra mile. So that's another example of how wonderful they treated you.